Good afternoon. I'm Becky Tuttle. I'm council member for District 2 for the city of Wichita, and I hope everyone is staying safe and that they're staying at home and trying to keep their spirits up during this challenging time, not only for our city, our county, our state, our nation, and truly our world. I'm here with Sedgwick County Health Director Adrienne Byrne. Adrienne and I worked together years ago when I was at the Sedgwick County Health Department, and I'm glad to call her not only a colleague, but a dear friend. Good afternoon, Adrienne. How are you?
Good afternoon, Becky. I am well.
Good. For those of you who may not know, I used to work at the Sedgwick County Health Department, and Adrienne and I worked together when I was there, and she was not only a great colleague, but a mentor for me for many years. And one of the things that we explored together in 2009 and 2010 was the H1N1 pandemic that we had in our community, and Adrienne was a major factor in that and certainly helped to lead our community during that. Any comments about that, Adrienne?
That is one of the best memories I actually have for being with the county. It was just a great experience working with everyone because we came together at the health department and had a lot of community volunteers. And there was more consistency with that, but it really was a good time.
Yeah. And one of the things that I've continued to share with people in the community is that during this very uncertain time, the one thing that they can rest assured is that our friends at the county have experience with this, not only with H1N1, but a really robust experience of practicing and preparing for public health emergencies such as this. And so we're grateful for your leadership, Adrienne. Thank you for you and your team and all they're doing. So you've been working closely, obviously, with COVID-19 from the start and public health for many years. I know you've been a valued public health professional in our state and in our community. And what do you think is the most important thing that residents can do to protect the health of themselves and others?
I'd say, firstly, to take this seriously. I know that some people are struggling with that, but this is very serious. And if we all take it seriously, then everyone is going to practice that social distancing of staying 6 feet away from people and washing our hands really thoroughly, coughing or sneezing into our elbow. And it really is essential. And I've done a lot better myself, is keeping our fingers away from our face. That is absolutely essential.
Great, thank you for that. One thing that I've talked to people in my district, but then also friends and family, not only in Wichita but across the nation and actually the world. And we are sheltering in place. I occasionally come out for some functions at the city. We've been to the grocery a couple times, but I tell people, while it's not my favorite, it's really an inconvenience, right? And by the inconvenience that I'm giving, I'm hopefully keeping other people safe. So very important for people to take it seriously. Just like you said, I appreciate that comment. When you see the numbers of positive cases in Sedgwick County are rising, we are all monitoring it every day. When do you expect that to level off? Or we hear a lot about flattening the curve.
Yes. And there are so many uncertainties with this because, as people say again and again, these are unprecedented times. And we're doing our best with the data that comes to understand COVID-19 better. So looking at some of the states around the country and the state of Washington, we're thinking that we may have our peak at the end of April. So it's not going to be over anytime soon. The community has done a great job of rallying. It's just important to stay at home. But we're looking at we're thinking the end of April that's going to happen.
Thank you, Adrienne. As I mentioned, we really appreciate all that you and our partners at the county are doing and tracking the cases and to keep us informed. I think that's the thing that I think brings peace to people's heart is when they feel that they have good information and it can help their family to make good decisions. And you really are doing a great job providing daily updates. If somebody does think that they or someone they know or love might have been exposed or they're just really worried about COVID-19, what should they do? Who should they call?
They should call our great partners at 211. We've partnered with them in the past when we've had measles outbreaks where they answer all the calls, but they're doing something additional this time, which has provided us with so much help. They have their own triage line. So if someone believes they've been exposed or have symptoms, to call 211 and they will ask certain questions to see if they have the symptoms of COVID-19 that are fever, difficulty breathing, and a cough. And if they meet some of the criteria, then they will connect them with our nurse triage line here at the health department. We will ask more specific questions, and then if they meet the criteria that Kansas Department of Health and Environment has right now, then we will set them up an appointment to be tested.
Thank you for that. I appreciate that. It's great information for folks. We also have a city website. If anybody's interested, they can go to wichita.gov/COVID virus and give the latest updates and get more information about things that we're doing at the city. Adrienne's done a great job answering questions, but people may have more. So we're going to open it up and see if there's any questions for Adrienne or myself at this time.
We've gotten some questions. How is this more serious than the flu? If this question is for Adrienne.
It is spreading more quickly. The seasonal flu, even though there are a lot of deaths every year, and one death is too many from the flu, because we have deaths in Sedgwick County every year and in Kansas. This is the number of people that are affected and infected by the regular season flu are in the millions in our country. So even though there's a lot of people that die compared to the number of people that actually have the flu, the death rate is like 0.001, where with COVID-19, and we're only able to do so much testing all over the country, so we really don't even have an accurate feel. We have an estimate based on the limited testing that we've been able to do around our country, that the death rate is around 3%. And so that is even though it still seems like a small number, that is a tremendous increase from 0.001 or 0.01, and it is spreading very quickly.
Perfect, thank you. Does Sedgwick County have any plans to recommend masks for folks going out to run those essential errands?
Everything is changing so quickly. In the beginning, our first responders, unless they had full PPE, which is personal protective equipment, and that was an N95 mask, goggles, or a face shield, gloves, a gown, they were going to be considered exposed to a positive person and have to be on quarantine. Well, as time has evolved, and we know that personal protective equipment is not to the level we need it at all, that is no longer true. That they can have a mask on and not be considered exposed to a positive, or need to be taken out. They just need to monitor if they ever get symptoms. So now I forget where I was going with that.
Wonderful.
What about masks? Does Sedgwick County have a plan for masks after, when the stay-at-home, shelter-at-home is over? What's the next step? Or while they're out now running errands?
And as far as recommending, so if you see people out with masks, whether they're homemade masks or surgical masks, but surgical masks are still in short supply, so it's really important for our first responders to have those. But in our nurses and doctors and other medical personnel in the hospitals. But those masks, those surgical masks, really are to keep our germs in. So they're not going to protect us so much from other people, but protect other people from us, since we know that asymptomatic people, or those people that don't have symptoms, there are some that can transmit the virus. So there's CDC, Center for Disease Control, is saying it's better than nothing. And so if people if they have those homemade masks and want to wear those out, it helps protect any germs that they might have from being spread.
But the best is still to shelter at home, stay at home, be
Absolutely.
safe. Absolutely.
Stay at home.
We do have several more questions, but this is a comment from Cassandra. She just says that she's so grateful to everyone helping to communicate and inform of how many cases there are, even though there's more, so that her family and everybody else around her can protect themselves. So thank you, Cassandra.
Thank you.
I'm sure that's nice to hear, Adrienne. I know you guys are swamped.
Yes.
Is there plans to have access to at-home testing? Will that become available to residents?
Not at this time, and we don't have any of those resources. There may be some communities that do, and I have seen some information on that, but that's not something we have right now. Our goal is still to get enough of the swabs that are at really short supply that we want to get enough swabs in so that we can open up the criteria. Because right now we are sending to KDHE and they have pretty stiff criteria. But once we get more swabs in, we do have a contract now with a laboratory here in town, Quest, and we'll be able to open up the criteria to just people that are symptomatic versus having to be over 60 or pre-existing condition. So we really want to be able to test people that are ill and not have such a tight criteria. So we're just waiting on getting more of those nasal swabs in, and then we'll be able to increase the amount of people that we see at our drive-through every day to at least 300.
Perfect, thank you. We've got some more. How are we set for tests in Sedgwick County in terms of population or numbers? Do we have enough tests?
We are not set. Just like everywhere around the country, Johnson County got approval from their board to test a lot of people, but they're in the same boat that we are. So even though their goal is to test, I think it was 3,000 to 5,000 people, they still need the swabs just like everybody else does to be able to take the samples to send those off to the labs to be able to get that test result. Slowly but surely, I mean, we're ordering. We have people in the county. I mean, even our manager and his staff. There are people that are every day reaching out to vendors to see if they have more of a supply in. So we have turned over and continue to turn over every rock there is to get these supplies in so that we can test more of our residents.
Perfect, thank you. I know everyone's anxious for things to get back to normal. How will we know that things are starting to get back to our regular normal day to day?
That is a good question, and we're still learning from other states around the country, and no one really is back to that place yet. We can see some of the other countries outside of the United States, but at this point, it's going to be when our cases begin to reduce, and we're going to have to be careful about not saying, hey, the stay at home, all this order is now done with, and we can just go back to our usual life. I think we're going to have to be very cautious with that and possibly continue to do some testing when that time does come. But at this point, it really is week to week. We'll see where we are at the end of April. If our spike really does occur at that time. And again, so much of this has to do with people staying at home. And there's still a lot of people on the road, I think much more than what should be. So please stay home. Don't use grocery stores and getting fabric at Hobby Lobby or wherever as a chance to have a social outing with a family of 4 or more going. One person should go into the store at one time unless they need aid, as some people definitely do, and then send 2 people. But part of this is how much people comply with non-essential businesses, and even some essential businesses have decided to close temporarily, but everyone really responding to that stay at home and the social distancing.
Perfect. I think we have time for one more. What can the average person do to help others?
That is a great question, and there have been a lot of people that are stepping up to do that, showing how strong our community is in Sedgwick County. I'd say one thing is even the younger people that feel like they're invincible, the virus has much less of an effect on them, but they can still be transmitters. So it's very important for everyone to take social distancing important, as well as washing their hands. And if they know someone is at home and they have an extra puzzle or an extra book, to go ahead and put something on your neighbor's porch that they might be able to do when they're home. Maybe it's a homemade card that says, I know you're going through a hard time, here you go. And this stay at home is hard for everybody. So just important to be friendly and to support each other in any way that we can.
All right, thank you. Thank you to everyone who sent in questions. I think that's fantastic. And I just want to follow up with the last question when Adrienne gave such a great answer, but when people said, somebody asked what they could do, what can the average person do? Stay at home. That truly is the best thing that anybody can do right now, is to help everybody else. And I loved all the other examples of helping your neighbors that Adrienne gave, but everybody can do something in this situation, and that's stay at home. So I know this is a very uncertain time for everybody in the community and in our county, and I just hope that everybody knows that your entire City of Wichita Council and Mayor are here for you and doing everything that we can to make sure that we're safe, and that when this is over, and it will be over, that we will continue to be a wonderful community that is an all-America city as we received last year, and just a fantastic place to live, learn, earn, play, and pray. And I also want to thank our first responders and our medical personnel who are working night and day to keep us safe. Last week, the end of last week, was Doctor's Day. In my work in public health and also with the medical community, I always celebrated Doctor's Day with my colleagues, but never more than this year. And so if you have somebody in your family or friends or neighborhood or where you practice your faith, whatever, that's a healthcare provider, take a moment and thank them for what they're doing and for the selfless acts that they're giving all of us so that we can all be safe. And then also another passion area for Adrienne and myself is mental health. So to thank all of our mental health professionals who are really finding innovative ways to make sure that this community in this time of need is getting the demand for mental health services. It's challenging. It's challenging for my husband and I to be at home. We're never home this much together, let alone home together. So we're finding ways that we're making sure that we're taking care of not only our physical health, but also our mental health. And also, we just want our community to get back on its feet as quickly as it possible, and we're trying to put people first. So ensuring the health and well-being of our community is the number one priority of the City of Wichita. So again, my kudos and thanks to the county. Thank you for everyone at the health department, my friends who are there. We're thinking about you. Thank you.
You're welcome, my friend. I'll talk to you later.